Hello, medicos. This is a session on pathological calcification. So, what do you mean by the word pathological calcification? Pathology means there is some abnormality, calcification. So, there is deposition of calcification in abnormal quantity. Definition tells that abnormal deposition of calcium salts in the tissues other than osteoid or enamel. So whenever there is deposition of calcium in excess amount other than osteoid or enamel, it is called as pathological calcification. There is also deposition of magnesium, iron and other minerals in other areas than osteoid or enamel region. So the pathological calcification is subdivided into dystrophic calcification as well as metastatic calcification. Moving on to dystrophic calcification. So what do you mean by dystrophic calcification? There is abnormal quantity of calcium deposition in dead or dying tissues. In dead or dying tissues, then it's called as dystrophic calcification. So there are two main important causes. First is necrotic cause. So necrotic cause is mainly seen in infarcts, thrombosis or hematomas. In these cases, we can find the deposition of abnormal amount of calcium salts. It is also seen in calcification of caseous necrosis, mainly in the tuberculosis cases. Also in the enzyme fat necrosis. It's seen in dead eggs of cystomata, cysticercosis and hydrated cysts. Moving on to degenerative tissues. Even in degenerative tissues like the heart valves, due to aging or in damage of the heart valves, we can see there is abnormal quantity of calcium deposition. It's also seen in atherosclerosis, goiter and cyst. What do you mean by Monckeberg's medial calcific sclerosis? Very, very important. What is the meaning of Monckeberg's medial calcific sclerosis? The calcification occurs in tunica media of muscular arteries. Very, very important. Where does the calcification occur? Where is the deposition of calcium taking place? It's mainly taking place in the tunica media of muscular arteries. The calcification occurs in tunica media of muscular arteries. It's mainly seen in the olden age group people. Samoma bodies. So, what do you mean by Samoma bodies? These are single necrotic cells on which the several layers of minerals gets deposited progressively to create a lamellated shape. So, there is deposition of minerals of like several layers. There is deposition of minerals layer by layer, and it creates a lamellated shape. It creates a lamellated shape, and this gets necrotized. These are called as Samoma bodies. Further, moving to the diagram of dystrophic calcification, what can you note in this diagram is there is deposition of white color substance. So what is it? It's nothing but calcium. So there is deposition of abnormal quantity of the calcium. The fibrosis and dystrophic calcification of pancreatic parenchyma. The next topic is metastatic calcification. What is metastatic calcification? There is deposition of calcium in normal tissues in living individuals. So difference is dystrophic mainly occurs in dead and dying tissues, whereas metastatic calcification is the one which occurs in living tissues. It mainly occurs due to increase in the metabolism of calcium, that is due to hypercalcemia, and it also might be due to dearranged calcium metabolism. These are the two main important causes. First is due to hypercalcemia and due to dearranged calcium metabolism. There are four primary causes. First one is due to elevated parathyroid hormones levels. There is increase in the parathyroid hormones levels which causes bone reabsorption. It's mainly seen in primary hyperthyroidism, in adenomas, and secondary hyperparathyroidism in paraneoplastic syndrome. It's mainly seen in primary hyperparathyroidism in adenomas, and secondary hyperparathyroidism, it causes paraneoplastic syndrome. Second one is the destruction of the bone in tumors like myeloma and leukemia. Here also you can see there is abnormal amount of calcium deposition. Vitamin D related disorders like intoxication, which causes increase in the absorption of calcium and leads to deposition of calcium in excess quantities. It's also seen in renal failures, which causes potassium retention and therefore increases the parathyroid hormone level. It occurs throughout the body but favors that tissue which excretes acids. Very important point. So it occurs throughout the body but it's seen more in those areas where there is increase in the excretion of acids because these areas favors the calcium deposition. Note this point. So it's also seen in gastric mucosa in the fundic region. It's seen in lungs, mainly in the alveolar wall, and kidney renal tubules. So the main important sites includes the lungs near the alveolar septa, kidney region near the renal tubules PCT and DCT region, and also systemic arteries and pulmonary veins are the very important areas of metastatic calcification. It's also present in these blood vessels, systemic arteries and pulmonary veins. It's also seen in stomach near the gastric mucosa region. So what are the four important sites? Lungs near the alveolar septa, kidney, renal tubules PCT DCT, blood vessels, systemic arteries and pulmonary veins, stomach near the gastric mucosa region. Looking at the metastatic calcification diagram, we can see there is a white patchy layer. These are nothing but abnormal amount of calcium deposition in living tissues. So there is calcification in normal tissue whenever there is hypercalcemia due to increase in the calcium level. These might be due to excessive mobilization of calcium from the bone or due to excessive absorption of calcium from the gut. So the last, that is the difference between dystrophic and metastatic calcification. So dystrophic calcification, D stands for D, so dead and dying tissues, whereas metastatic calcification is seen in living tissues. So this is the first difference. First point is done. See, dystrophic seen in dead and dying tissues, DD, metastatic is seen in living tissues. Serum calcium level is normal in dystrophic calcification. This is a very important point to note. Whereas in metastatic calcification, there is increase in the level of calcium. Dystrophic calcium level is dystrophic calcification, the calcium level is normal. Whereas metastatic, there is increase in the calcium concentration. It's also seen at the site of necrosis. Next point, very important point. Dystrophic calcification is mainly seen in necrotic areas. It often causes organ dysfunction, whereas metastatic does not cause any clinical dysfunction. The best example for dystrophic calcification mainly includes the RAT. So what does RAT stands for? R is for rheumatic heart diseases in cardiac valves. A stands for erythematous plaques and T stands for tubercular lymph nodes. Tumors. So the mnemonic is most for PG. The common standard mnemonic is most for PG. So M stands for meningioma, mesothelioma. O stands for papillary carcinoma of ovary in the serous ovarian cystadenoma. S stands for papillary carcinoma of salivary gland. T stands for papillary carcinoma of thyroid. And P stands for prolactinoma and G stands for glucagonoma. So remember at least any 3 or 4 examples, that's enough. So metastatic calcification is mainly seen in the living tissues, which is associated with the elevated serum calcium levels, as I've said it. So it does not cause any clinical dysfunction and it's seen in hyperparathyroidism, renal failure, vitamin D intoxication, sarcoidosis, milk alkali syndrome, multiple myeloma, metastatic tumors to bones. Remember any 2 or 3 ones. So it's usually found in organs which lose acids and have alkali environment inside them, like the lungs, which is most common because it's a type of, you can see what kind of necrosis here. It's a kind of caseous necrosis present in the lungs. Therefore, it causes tuberculosis. It's also seen in kidneys, stomach, systemic artery and pulmonary veins, etc. So that's it about the difference between the dystrophic and metastatic calcification. So hope you have understood about this video. So thank you. Please do like, share, comment and subscribe.